or exercise for PCOS kind of video. I thought I'd combine a couple different things, but ultimately it comes down to the same suggestions. So you can use this little template for pretty much anything. The idea when you come to see me is to help make a lifestyle change. I help make a lifestyle change for you with suggestions that might have worked for other people in the past, or ideas that might just resonate with me when I kind of pick apart your case, your history, your loves, your weaknesses, your strengths. So the idea with exercise is that, or activity, is that it's part of the three-prong approach of nutrition, activity, and some form of mindful practice. Now there's other things like proper sleep, love, and other things to take care of getting you to 100 years of age, but as far as activity is concerned, it sometimes seems real easy. I have a lot of people that come in to see me, and I kind of get an interview going, and I find out they're doing 10,000 steps a day. They're counting their Fitbits. They're doing great with the steps. But the question is, most of them are doing great with the steps, but not losing weight, not lowering cholesterol, not lowering their blood pressure, and not lowering their sugar. So those are the typical things, those are the cluster problems that occur when people hit 40 or 50 or 60. And then suddenly it's like, okay, well, what do? If we can't do it with natural means, take medicines. And medicines do work, but I think a lot of my colleagues are being short-sighted when they don't invest in exercise prescription. So that's what we're going to talk about today. Specifically with regards to PCOS, or slightly obese or slightly high sugar, pre-diabetes, I think there's reasons that we prescribe exercise. An exercise prescription used to be something that a sports medicine doc would do in the past, but I think your regular doctor should be able to do it. But the only problem is, in medical school, and I teach at UIC Medical School, and we don't really have, of 4 years of curriculum, we don't really have time to teach activities, nutrition, sports, injury, musculoskeletal medicine. So it's sometimes saved to residency, but residency doesn't have time either. So anyway, that in combination with the No Child Left Behind rule, where we're trying to make everybody be able to pass tests in school, you're kind of taken away from physical education just to get the test practice. So I think a lot of my young kids are getting fat. And it's a shame, because that generation that is used to being obese or not really doing anything with activity, not being able to do a pull-up, not being able to run a quarter mile or a mile, they're going on to start families on their own and going into their 30s, 40s, and 50s with loaded medical problems, diabetes and cholesterol even before they get to middle age. So here we go. I did this little schematic, and I have a lot of other videos. If you just Google search or YouTube search DrRic tutorial exercise, a bunch of other things will pop up. In this case, we'll try to I'll try to explain why exercise is so valuable, and maybe how to kind of template your own before you see me or any other integrative medicine doctor. So the idea here is that if we look at what happens with weight, food gets into the stomach after being chewed properly, and if the stomach acid is working properly, and you don't have any reflux, and your pancreas over here, I didn't draw that, but pancreas is making enzymes properly, then the food will be rapidly broken down into basic building blocks: fats, proteins, carbohydrates, vitamins, and minerals, and then it'll go into the bloodstream. This is the blood vessel that leads to the heart, and when it gets into the blood vessel is just a conduit, so it carries from one place to the other. Typically, the blood vessel is very delicate, and it's a pump, part of a pump system, and you don't want to be having high amounts of protein, fats, or carbohydrates floating around too long, because it'll irritate the lining, very sensitive, and that leads to other things down the line: high blood pressure, inflammation. So once it gets into the bloodstream, if it gets to its destination, then it has to be absorbed out. So what usually happens is all those great macronutrients, specifically carbohydrates, get absorbed into the cell. This is a cell, basic cell, nucleus, mitochondria, little endoplasmic matricula, and a cell has a front door. The front door to the cell, when there's enough carbohydrate around, and for all intents and purposes, Americans just eat way too many carbs. And when there's a lot of carbohydrates around, it's irritating. So you stuff it into the cell, but how? You have to secrete insulin. Again, this pancreas that's supposed to be over here secretes insulin when it figures out there's a lot of carbohydrates around after a meal, And the insulin, the carbohydrates, they lock and key together and they get into the front door of the cell, take all that irritating stuff out of the blood vessel into all these cells. That's what's supposed to happen. It goes into the brain cell to make neurotransmitter, the hormone cells to make testosterone, progesterone, cortisol, the thyroid. It goes into the muscle cell to build muscle, goes into bone to make strong bone. So all the cells incorporate the energy packets. The unfortunate problem is sometimes if you have way too many carbohydrates, like in an average American diet, the insulin eventually will not, the cells will desensitize themselves to the insulin because there's just too much insulin to match the way too much carbohydrate. So you have what's called insulin resistance. That's the first step of prediabetes. When suddenly these cells say, "Ooh, that's too much. I can't take all this carbohydrate." They close the front door. They become insulin resistant. You just have this excessive amount of sugar floating around in the bloodstream because it can't get diluted into the cell. That's why you have high sugars when you stick your fingers. That's the beginning of diabetes. First, it starts with prediabetes. But that can also happen with polycystic ovarian syndrome too, because there is an insulin resistance there too, and obesity, and other diseases. So this is the basic building block, and you can get around that. You can get around this insulin problem, this insulin resistance problem, this unresponsiveness to insulin, even if you have or control your carbohydrates. Sometimes if you have years of carbohydrate excessiveness and then you cut down, you're still insulin resistant. It'll take some time before the cells start to open their front door again. But here's the secret. You can go back door. Exercise, there's a backdoor mechanism where you don't need insulin. Exercise, if it's triggered properly, 2 times a day, some form of activity, I'll talk about that in a second. The back door does not need insulin. Sugar goes, or carbohydrates, goes straight into the cell. No insulin necessary. It's a built-in mechanism for fight or flight. Here's the thing. If your body thinks it's trying to run away from a saber-toothed tiger or a Tyrannosaurus Rex or get out of a mud pit, you don't want to wait around for insulin to be around. You just tell the muscle, move. Muscle gets prioritize amounts of carbohydrate for energy packet. Go, run, fight or flight. So that's cool, right? Don't need insulin. The unfortunate problem is nobody tells anybody that exercise will do that. Exercise is the first treatment for depression. Exercise is the first treatment for diabetes. Exercise is the first treatment for high blood pressure. Everything. Exercise, really, movement is all that important, but we devalue it because it takes effort. It doesn't take any effort to swallow a pill, knowing that you're going to have side effects if you have high blood pressure, diabetes, thyroid disease, or other things. But so anyway, that is how exercise works and why it's so beautiful as a prescription. Now, the specific type of exercise that your doctor is supposed to give you, that's a little different. I think you have a wide variety. Walking, I love walking. I used to do marathons, but I slowed down. I'm 54, going on 55, Sammy Hagar. So I slow down and I do walking, but I don't just walk. I carry about a 30 to 60 pound pack, and I walk very strenuous trails in our national parks. Check out my Facebook page, DrRic Hiking Excursions, and you'll see what we've done. But walking is great. Walking is one thing, one form of cardiovascular. If, again, as I was alluding to before, if you do 10,000 steps a day, that's cool. But when it's at work, that don't count. When it's at work, there's a certain amount of stress that kind of negates the exercise or the walking, the steps per day. It's certainly great that you do steps per day. It's great that my construction guys can swing 5-pound sledgehammers all day, or my roofers can stay balanced on top of a roof and go up and down the ladder with packs of shingles on their shoulders. That's great. They can do that better than me, but a lot of those folks still have high blood pressure or obese. So the problem is the things that you're doing now, if you're off balance, high blood pressure, overweight, cholesterol high, sugar's high, cysts in the ovaries, then those exercises or that activity isn't really cutting it for you. You got to do something different. So again, this is where we say, okay, if you walk, fine, but I want you walking outside of work. So this is where we accumulate walking steps, peaceful walking, walking in nature. See my videos, DrRic tutorial, nature therapy, or hiking. Cardiovascular, walking, the next step is always cardiovascular. Cardiovascular fitness in the form of swimming, bike riding, running, always great. depending, if you go by Ayurveda, not all of those cardiovascular exercises are great depending on the person. If you are way too anxious, you should slow down in your cardiovascular. Not aggressive cardio, but peaceful cardio. If you're kind of sedentary and slow and depressed, you want stimulating cardiovascular exercise. So cardiovascular exercise can really depend. If you're out of shape, your heart will move just with getting off the couch. If you're in shape, you want to push that paradigm. So heart rate measurements and perceived exertion are something that you can kind of measure as far as how strenuous your cardio is. Sweating certainly can be easy if you're a beginner, or you might not sweat if you're just cruising along and even do marathon pace. So you have to have somebody that you can answer to, like a coach or a physical therapist. And by all means, if you're obese or you have problems with your knees or back, before you go jump into an expensive LA Fitness or Lifetime Fitness, please ask your doc, ask me to see a physical therapist for a prehabilitation exercise routine. On the insurance, depending on your deductible, you should be able to see a physical therapist to kind of eyeball your gait, your back, your feet, your knees, see what your technique is. Then you can take those techniques that you learned and take them to the gym with you. Personal trainers are also very good if ACSM certified, American College of Sports Medicine certified, or if they're just by word of mouth, very good. So always have an authority to answer to. They'll probably be able to think outside the box if you don't like the activity that you're doing. The other things to also consider, aside from walking, swimming, running, and bike, resistance exercises, whether it's band work, calisthenics like Jack LaLanne, see my tutorials on exercise Jack LaLanne style, or exercise 30 minutes. There's resistance exercise. I think that's really the key to losing weight. Building muscle with all those movements that you do with using all the muscles are important. Even if you don't get as sweaty as a cardio exercise, cardio and running, we all, especially if you're competitive running, we all have an efficiency of running. So we get into a groove, so you're doing 4-minute miles and you will save energy. So you're essentially, you're moving, but you're not burning that much energy because you got to save it for the 26th mile. So marathoners are usually skinny, but just because you do a marathon doesn't mean that you're really burning up properly. And it also depends on how much you're taking in calorie-wise. It also depends on how you're eating. If you're eating in stress, it's going straight to fat. Now I'll explain that in a second. There's also, so you choose what type of resistance exercise to do, but please incorporate that into your routine, especially if what you're doing now isn't working and if you're still overweight or plateaued. Throw in resistance. If you don't like it, that's fine. If you're a muscle builder and you don't like cardio, that's fine too, but use it as a shock and awe for about 2 to 3 months and then return back just to mix up your muscle responsiveness and just for a change. You might love it. Flexibility. I always used to do stretching exercises 10 minutes before I would spend 2 hours in the gym weight training. Now it's totally reversed. Never thought I would be a yoga teacher, but somehow Deepak Chopra got me to do it. So now I do flexibility. I do exercising with resistance, 30 minutes of intense, high intense exercise, and then I do about 1 to maybe 1.5 hours of yoga if I can. So flexibility is very important. That is a form of exercise. If you think flexibility isn't that strenuous, come take one of the yoga classes that I take. Go specifically for Ashtanga yoga or hot power yoga. Let's see if you make it through. It's very strenuous. It's isometric exercise. It's also breath exercise. It's also meditative movements. So I think it's very important. It has a mix-up. Finally, bounce exercise. I put bounce here. It's more plyometric. I think being able to do a burpee or being able to do a jump squat, all those movements, like the CrossFit guys, actually develop and move muscle a little differently than everything else here. It's just for a change-up. It's kind of nice to be able to just break away. I always think of my plyometric exercise as a reminder of what I used to do in high school. It's nice when you can run just out of nowhere, just run a 1/4 mile, or jump up into a tree, or climb a wall. It's always nice to do that. It makes you feel young again. And certainly it's good for emergencies, but or even pull-ups. I know a lot of high school kids that can't do pull-ups. I mean, that's not good. Anyway, so these are the types of exercises that your coach is supposed to put together for you or design for you. Again, they might not resonate with you, but try it. It might be an option that will take you out of the original stuck mode you're in and then get you to lose weight again. Then you can always go back to what you did before, but don't just do the same old stuff that you did before. So those in a nutshell are the things that we do to get the energy out of the blood vessel, out of the blood, into the cell, utilized properly. And that's the backdoor approach. So the reason for this, I just explained. The amount, if you can do it once a day. I know most of you that work 50 to 60 hours a week can't afford too much time, but it doesn't have to be that much. Just lock your front door, head on out, at 15 minutes, turn around, come back to your door, get inside, you're done. I wouldn't necessarily go at a slow pace. I might go a little faster. Those of you who walk now, you might want to throw a backpack on and carry more weight as a resistance exercise to make it a little more challenging. Or you might want to find an uphill grade, steps. Those are all ways to give more work. And the old program of a lot of work and decreased food intake is always going to be useful in figuring out how to lose weight. But finally, that mindfulness thing and why I mentioned about calming. When you're in stress and fight or flight, I mentioned what happens this way. You can also take food, macronutrients, and have it go straight to fat cells. If you're totally in stress, think of the abused kid. If you're in stress all the time, your brain thinks fight or flight all the time. Even when you're about to go to sleep, it's going to tell you, get ready for running and put every morsel of food into fat. It's not going to go this way. It's going to go this way, which is bad. You'll hear a classic, I don't eat that much food, and I've seen food diaries before, and they are almost 1,000 calories a day, but patients are still having problems with losing weight. I think it's because of this. That's when your adrenals are shot, that's when your sleep is screwed up, that's when you wake up unrefreshed, or you're being bullied. And that's when all the stuff you eat and drink goes right there. It goes into fat no matter what. And you just gain weight. That's that typical polycystic ovarian syndrome kind of look. Skinny arms, skinny legs, and a big center. That's a problem with polycystic ovarian syndrome. I have a video, DrRic tutorial PCOS. Check it out for those of you who suffer from it. But whether you have PCOS or insulin resistance, it doesn't matter. It's all the same. This will work properly eventually if you get it routine, if you have a ritual, if your muscles get attuned to this, if your heart's used to it, if your brain tastes the endorphin and enkephalin exposure. It'll all benefit in the long run, but it does take time. It takes time and sometimes conquering frustration. So that's why you really should approach this with a little bit of openness, expecting challenges here and there, but hiring coaches to get you moving. So hopefully this helps. This might be an introduction to other exercise videos, but this is the basic reason why we use exercise prescription.